I'm Jane Hartley, and I'm going to talk about levelling up in terms of health. The North East has the worst health and higher health inequalities compared to the rest of England, and it's getting worse, particularly since the impact of the pandemic, which has widened the gap between the North East and other regions. And there's also substantial variation between deprived and affluent areas within the North East itself. What do we mean by health inequalities? Well, they're driven by unequal distribution of the wider determinants of health, often known as social determinants. And what do we mean by social determinants or wider determinants? We mean things like education, environment, where and how we live, work, income, social connectedness. This all influences our overall health and well-being. And there's a strong and persistent link that's been evidenced between social inequalities and the differences in health outcomes. So, addressing the wider determinants of health has a key role to play in reducing health inequalities. In a recent research paper, Levelling Up Health, a practical evidence-based framework, it states, any programme of levelling up health needs actions across multiple sectors to address this unequal balance of the wider determinants of health. It also needs a locally designed focus. Services and programmes need to be designed around the specific needs of places and communities, especially in disadvantaged or ethnically diverse areas. Evidence suggests that programmes with good community engagement are more likely to be effective. Targeting disadvantaged communities. Disadvantaged areas and communities need bespoke interventions above and beyond what is provided to the rest of the population. Also, matching of resources to need. More resources should be given to those with more need to enable extra support that they need to enjoy good health. And finally, levelling up should be a core part of the cross-government levelling up activity. A long-term cross-government levelling up for health or health inequality strategy is needed to drive national, regional and local action. So what's happening within our region to level up health? Well, tackling health inequalities has been recognised as a priority by our regional health system partners in the integrated care system, and also the need to work with communities to understand their needs, and that greater collaboration and investment in community-based approaches is required to improve health and well-being. The voluntary and community sector is seen as a key partner to harnessing the power of communities. So, through financial support from these partners, VONNE have established a Healthy Communities and Social Prescribing virtual network, and we are representing the voluntary and community sector within the various health inequalities working groups and committees within the ICS. Details of how to join this network will be provided. We are also supporting an ICS pilot, the Community Connector programme, which is developing a network of community health champions from our most disadvantaged communities to enable taking a peer approach to improving health at grassroots level. We continue to run the Thriving Communities programme, made up of webinars, bulletins and learning and collaboration opportunities, targeting the community and voluntary sector groups, delivering activities and support to those communities experiencing our worst health inequalities at local level. And again, a link will be provided. So I'd like to finalise this by saying, together we can make a difference, but we must do it together. We can't do it alone. Thank you.